Meanwhile, in Alberta, COVID-19 hospitalizations at a record high. For a closer look, we're joined by Dr. James Talbot. He is Alberta's former Chief Medical Officer of Health and an adjunct professor at the School of Public Health at the University of Alberta, and he's kindly agreed to come to us from Toronto. Dr. Talbot, thank you for your time.
Thanks for having me.
It's been quite a week in the province of Alberta. As you look back on it, what's your biggest concern right now?
Well, my biggest concern is that, as one of your previous speakers said, this is just going to get worse. And we could be looking at a situation with this kind of killing stress on hospitals going on for weeks to months because the government is not doing anything that would lead you to believe that we're going to see a decrease in the number of cases.
There has actually been reference by officials to the fact that ICU spaces are becoming available in some cases only because patients are dying and creating a space that way. When you hear that, what do you think?
Well, it fills me with sadness and anger. The person who said that was Dr. Verna Yu, who is the CEO of Alberta Health Services. I know Verna, and she's a tough, resilient physician who's not unused to stress. And if you watch her when she gives the statistics, it's clear that she's grieving for what's happening in the system right now. And let's be clear about it. 8 out of 10 Albertans have had 1 or 2 shots. So they've said they want to get out of this by being immunized. And 2 out of 10 Albertans are now clogging up the hospitals so badly that the 8 out of 10 are being denied things like chemotherapy, elective surgery, and could eventually run into a triage protocol where worse things happen because of how clogged up the system is with those who are not immunized.
So from your point of view, how do you get, or what is the issue with that remaining 2 out of 10? And how do you bring them on board?
Well, I think it's twofold. I mean, first of all, they would not, first of all, they're also victims. Like the people who die who weren't immunized leave behind grieving families and grieving friends. So, we can't deny them their humanity. But the government of Alberta in July just decided to allow them to be infected because they took off all of the precautions that were in place. And at the time, to try to cut through the noise, I was quoted as saying that doing that with Delta circulating in the province was offering it an all-you-can-eat buffet, and that's exactly what's happened. So what we need to do is to get the government to show some leadership. They got a bit of a bump in immunization when they came up with voluntary vaccine passports, which the Premier can't even bring himself to say the word. Everyone else that's tried it has gone with mandatory vaccine passports, and they've gotten far more buy-in. The Alberta government tomorrow, we haven't seen the new Minister of Health since he was announced, and in the meantime, we're losing 15 Albertans a day, 100 a week. He could announce that as of tomorrow, the government of Alberta is going to make vaccines mandatory for all Alberta government staff and associated organizations, and then either require or recommend it for other businesses that operate in Alberta. And we still have tools available to stop the spread of the virus in the community, but the government is just choosing not to use them. They say they can't. The truth is they won't.
So trying to separate the sort of medical from the political here, or should I not be trying to do that? Is that what has happened, that the two have become commingled to the point where the response isn't effective as it should be?
Oh, I think absolutely. I mean, the Premier himself has admitted that they had modeling that showed that the 4th wave was going to be bad at the beginning of August. And they chose not to inform Albertans. I mean, it's inconceivable to me that a government would do that, because just letting that information get out would have provided a stimulus for people to get immunized and allowed for businesses and schools to prepare. But they chose to suppress that information in spite of the fact that we were calling for it, the press called for it multiple times. So, there's no question that the government's actions in July and its inaction since then are contributing to the death of Albertans.
Some have suggested that the numbers might peak in a week or two because there have been some procedures put in place. You're talking about the passport, or in all but name passport. Do you think that is something that there could be headed towards a peak soon, or do you think that this is something that could catch fire and continue on, and to where?
I look at the statistics every day in the hope that we'll see that the peak has happened and that we're going down. At the moment, we still have about 1,700 cases a day that are testing positive. We're over the second and third wave high for hospitalizations and ICU beds, and we know that from the time you get something effective in place, it takes 4 weeks for the pressure to come off ICUs. So even if we did start to see a glimmer of hope next week, there's still going to be that killing stress on hospitals for a lengthy period of time.
Many are pointing to the fact that Alberta's 2 NHL teams are planning to play in packed arenas. The NHL has protocols as well, but still, is this an issue you're concerned about, or are there other more pressing dangers to the population in terms of this ongoing spread?
Well, I don't think you could separate them out. I think one of the things that you count on in public health is the public doing the right thing. And for that, they need clear and consistent messaging that they believe meets the common sense test. So you have a system in crisis that people depend on for surgery, for chemotherapy, for a bunch of other things. And you have the lowest immunization rates in the country. You have the highest circulating viral load in the community. We're at 11 times per capita that what is happening in Ontario. And you're going to go ahead and open up to large numbers of people getting together with some precautions in place, and hope you don't end up with more cases resulting in stress on the system. And then psychologically, you take a look at the stress the staff in the hospitals are under, where every day they're handing the phone to someone who's about to be intubated and won't be able to speak to their family again, and listen while those people are just distraught at the fact that they could have done something about this and they didn't, and they may never see their family again. To deal with that psychological discrepancy between business as usual in the community and the hospital care system about to collapse, I don't know how you deal with that psychologically.
Dr. Talbot, I want to thank you for your time and your insight on all this. Really appreciate it.
Thanks for having me.
It's Dr. James Talbot, the former Alberta Chief Medical Officer of Health, and we reached him in Toronto.